Good morning, everyone. So one of the strategies that I'm going to talk to you guys briefly is about our community health worker integration. Thank you. This has been a very learning experience for us, and our focus is on working with patients at the huge, diverse patient population and help our patients to eliminate and I first identify the barriers and then take it away from them so they can have the access that they need to quality health care. Our community health workers, they work very close with the patients as a liaison between the providers, healthcare providers, not only in Caring Health Center, but also specialists, and the community resources. We have a large, unified CHW team, and what I mean with it is that we have 7 community health workers. Those community health workers, we serve the language of Spanish, English, and Nepali. We also have interpreter services that we can work with other patients with all different languages. And they are consolidated in one specific leadership group. So they are supervised with the same team. And one of the, not only the organizations that we collaborate in, we already mentioned, also the technical assistance from the Massachusetts Department of Public Health 1422 grant and Neighborhood Health Plan has also helped us to be able to develop this strategy in this department. Some of the services that our CHW offer, and they're working with the patient, is outreach, not only in the community and on the patient's home, but also the patients that decide to just come and see them in the clinic for any specific reason. They do prevention and self-management education classes. Also linkages to community, which I think that's very important for our patients. Some of them, they don't know where to go, how to connect with the services that they need. So our CHWs are the main person right in front of them, and then on their side to help them to navigate through those services. The social support and advocacy for them. And there are many situations in which our CHWs, even I can share one experience with one of our CHW, which she took the public transportation with the patient. So she met the patient at the home. She went with the patient on the bus because the patient didn't know how to do it, and she navigated that patient to get to the specialist appointment. And I think that's huge to be able to educate our patients and help them to eliminate those barriers. Thank you.
Is it still morning? Good morning, everyone. Good morning. My name is Melissa Anderson, and I'm one of the CHWs, or community health workers. Very lucky CHW to be working with this incredible team. I'm going to speak a little bit to the wellness center that was mentioned earlier by one of my members of the team, and also how the CHWs are integrated within our wellness center programming. So the main purpose of our wellness center is to reduce barriers to physical activity, nutrition education, and chronic disease self-management. And we do that through a variety of programs. And I just want to point out that it's not just exercise and nutrition focus. We do work specifically with the chronic disease self-management program with helping to educate patients on how to better self-care or manage their self-care, and through stress management, stress reduction, how to create goals and set standards for increasing their health. So those are some of the main programming that we use in our wellness center. And I just want to speak to our staff that we have at the wellness center. I myself am one of the instructors, exercise instructors at the wellness center. There's also 2 other exercise instructors at our wellness center, one of which is bilingual, English and Spanish, And we also have a gentleman who comes in from the community who is an integral part in the community with bettering men of color's health. So he's definitely a great asset to have at our wellness center. And with myself, one of the programs that I do instruct is purposely for women to provide a culturally sensitive space for individuals who aren't able to exercise in front of men. So that's a great class to have, and it's been beneficial for several of our patients who have come. And it's really, I guess, from an anecdotal standpoint, from my perspective, it's been just gratifying to see patients come in and feel safe, and it's definitely been rewarding. So I just want to speak on the training that we have and also a little bit more about the services. We're all trained and certified in our respective exercise programming, and that includes Zumba, just group exercise, and so have you. We also are all certified to facilitate different groups, so diabetes prevention program, chronic disease self-management, which has been mentioned a couple times. And also what we have seen is that patients who are also being seen with the CHW are more adept to stick with the programs. And I think it's because they have that in-depth care and more of a connection with a member of the care team, once they leave the doctor's office, after 5 minutes of meeting with their provider, being with the CHW, it allows them to really open up and engage one-on-one with their CHW and to really get down to the nitty-gritty of what those barriers they are facing in their lives. So I just want to mention lastly that the Wellness Center is a unique space for individuals to come in and really focus on themselves. When they step out, there's so many different issues and barriers that they're facing, and that hour or two that they're here, either for programming to exercise or to become educated in nutrition and so forth, they really can focus on how to better their health and really focus inward and try to use those tools and those skills that they learn in our Wellness Center and bring them out into the world. So it's really gratifying, and I've enjoyed it very much so, and I look forward to continue with different programming in our Wellness Center and as a community health worker. So thank you.
Thank you very much.